Hello, good evening.
Good evening, sir.
Good evening, sir.
Good evening. Anyway, we are few, but we can start. Um, yes, last week we started the health education component of the course. And then we talked about the importance of health education, especially the various forms of the various types. We have the health education when we provide information, and this information can be used in preventing infection, like hygiene education, which, when it's applied, is capable of preventing diseases, including the critical time. I don't know if you still remember the critical time for hand washing. It's a form of education, health education, probably the simplest form, the one that was mentioned in primary health care. Okay. The next one, the second one is the patient education programs. Patient education programs are becoming very, very important, especially in the management of communicable diseases, especially in the management of communicable diseases like diabetes. In fact, any diabetic patient that is not provided with that education is receiving a substandard care, even if it is the best endocrinologist is the one managing the patient, because the diabetic patient is responsible for providing more than 95% of the health care of the patient. So the only way the patient can provide good care to him or herself, is to know what to do, how to do it, and when to do it, which is usually provided in a diabetic self-management education program. And these self-education programs are also very useful for chronic diseases like genetic diseases like sickle cell anemia. Okay. The next type is the behavioral change communication, which is very, very important in changing unhealthy lifestyles, especially the ones that are associated with these chronic diseases, like overnutrition, like sedentary lifestyle, like smoking. Eh? All those ones are behavior. Behaviors are usually very difficult to change. So, but with behavioral change communication, that is possible. Especially when the theories are applied, the behavioral change theory and the communication theory, when they are applied, they are able to, they are strong, they are potent enough to make someone with the bad behavior change. And then we have this the one we are talking about today, risk communication, in which we are able to communicate risk to members of the public. And then we have social marketing, which, if we have time, we'll be able to talk about it. And then we have advocacy. So today we are starting with risk communication. Risk communication is becoming very, very important. Very, very important, especially in this era of this social media era. Social media era where you have a lot of false information. You have a lot of false information. So it is the responsibility of a public health practitioner to provide the right information. To provide the right information against the falsehood that is usually paddled in social media posts, because even very ignorant persons can make a post claiming that that post was derived from an expert. Meanwhile, the post is filled with lies and half truths. Okay, so So risk communication is very, very important. And yes, it's very, very important. And then the important things about risk communication is the difference. Usually there are differences between the perception of the general public and the perception or the views of the experts, Okay, there are there are usually gaps in that. What the general public believe is at times different from what the experts believe. And in risk communication is to ensure that the views of the experts, which are usually the genuine views, should be communicated to the general public in such a way that they are able to make the right decisions. In fact, risk communication has actually been defined as the sharing of expert opinion on the hazard posed by an incident to the general public in a way that elicits the appropriate response from the general public. Recall, you will remember how we define a hazard. Hazard is anything with the capacity to cause harm. So those hazards are usually found in environments. The hazards are usually found in environments. So how do we communicate these hazards? How do we communicate this hazard is what is practiced in risk communication. And the practice of risk communication can be carried out using these 9 steps. 9 steps. We are going to go through them from step 1 to the 9th step. The first step is to know the hazard. What is the hazard? What is the hazard? Okay, we know what a hazard is. Hazard is anything with the capacity to cause harm, and we know there are of different types. We have the physical hazards, we have the biological hazards produced by living things that are not human, and then we have the social hazards that are produced by the interactions of human beings. At times, the hazards are natural. Other times, they are man-made. And man-made hazards are usually called anthropogenic hazards. They're usually called anthropogenic hazards. So the next thing is, having known the hazard, the next thing is to say how harmful is the hazard. How harmful is the hazard? How harmful is the hazard? And how harmful is the hazard is usually determined by laboratory or other investigations. And these investigations are now published in a book. In fact, the WHO and the US government and other international organizations, they have set up separate agencies whose responsibility is to provide information about the hazards we have in our environment. One of the agencies is the International Program on Chemical Safety. And this was formed in 1980 by the WHO, the International Labour Organization, and the United Nations Environment Program. This organization provides a complete dossier of most of the chemicals we have in the world. So if you want any information about a chemical, you can look at any of their publications. And then the United States has an agency, a special agency of the United States called the Agency for Toxic Substances and Disease Registry. They also have a large compendium containing information about most of the hazards in the world. So whatever hazard you think of, you have the information. And this information is what can be said to be the expert information. That is the correct information or the validated information based on several research studies. Okay, so the one of those information is the categorization of carcinogens. Remember, we said what carcinogens are. Carcinogens are things that are capable of causing cancer, things that are capable of causing cancer, and they are placed into 5 groups. The things that are capable of causing cancers are placed into 5 groups. The first group is group 1. Group 1. Group 1 is called the group of substances that are carcinogenic to human beings, meaning that they have been found to cause cancer in human beings. They have been found to cause cancer in human beings. Group 2 are called probable carcinogens. Probable carcinogens. And this group is subdivided into 2. One group indicates substances with limited human evidence of carcinogenicity, while the group 1A or 2B, we can call 2B, are those without human evidence, but the evidence can be found amongst animals. And then group 3, we have probable carcinogens. These are carcinogens these are chemicals with a likely whose mechanism of action makes it possible for them to cause cancer. And one good example of it is heavy metals. Heavy metals, they have the capacity to cause oxidants. Oxidants, and oxidants are like little fire in the cells, and this little fire can actually burn the inside of the cell, especially the genetic material inside the cell, causing cancer. And then we have the 4th group, non-classifiable. The 5th group is there are no evidence of carcinogenicity. So these are the 5 groups of possible cancer-causing substances. Okay, and cancer-causing substances. Okay, so we have to also state that even the substances that are placed in group 1, which are said to be carcinogenic, because they have both laboratory and epidemiological evidence. They are not all equal. They are not all equal. For example, benzene is very, very carcinogenic, which means that nearly everybody that is exposed to significant quantity of benzene can come down with cancer, compared to those that are exposed to black soot, compared to those that drink alcohol, or compared to those that eat roasted meat or suya. All these have been shown to be capable of causing cancer, but not of the same extent. So that is what an expert should know. Expert like us, public health practitioners like us, we should know that not all, although they are all capable of causing cancer, but the extent at which they cause cancer is not the same. So we should be able to communicate such to the general public. Okay. Then the other one is if something is said to cause cancer, what is the public health significance? If something is known to cause cancer, what is the public health significance? And in public health, we place a lot of emphasis on the young, the pregnant women, the young and the pregnant women, because they have a long life to live. So if a child is affected, he may develop the cancer at a relatively young age. For example, most carcinogenic substances take a long time, are slow poisons. They take a long time to cause the cancer. So if you expose a child say, of 5 years to a cancer, to a carcinogenic substance, and that substance takes say 20 years to give or 30 years to cause cancer. It means that by 35, the child will develop cancer. So that's why we don't pay as much attention as to say somebody that is 70. We don't pay much attention to those people, because if they are exposed and it takes 30 years, it means that it may not be, they may not even live. They may not even live to have the cancer. So that's why when you talk about exposure, we are interested in little children. We are also interested in pregnant women. Pregnant women because of the fetus they are carrying, the child they are carrying inside them. Because if one cell of a growing fetus is affected, it may be that single cell may be an eye, maybe a nose, maybe some vital body organ, and that's why they are prioritized. So they are prioritized in this third step. So you have to make sure, you have to look at the people that are better exposed, are exposed, and then try to do something. That will influence the action you are going to take. For example, even alcohol drinking, or drinking of alcohol in a pregnancy, is people talk about is banned. It's banned because of the effect it can have on children. So it means that even a woman can take alcohol, but it is not acceptable for a pregnant woman, to take alcohol, not for the sake of the pregnant woman, but for the sake of the fetus she is carrying. Because alcohol exposure, when a growing fetus is exposed to alcohol in pregnancy, it affects the development of the brain. So the child will not be as brilliant as it should have been. Okay, so we look at that. Then the other one is the fourth one is the fourth step is very, very important, is to determine the perception of the general public. How does the general public perceive the hazard? It is very, very important. Remember, group step 2, we talk about the expert knowledge. This knowledge that you get from those research papers published by those agencies. This stage 4 is what we find out. We find out from the general public by talking to them through media reports, through social media. We can monitor social media to decipher what they do, what they talk, what they consider about that particular hazard. You can do community survey. In that case, you are doing a study, and then you can do town hall. You can hold a town hall meeting with them to find out what they know, what they think, what they feel about a problem in their community, about what they feel about the problem in their community. Okay, so this perception is very, very important. This perception is very, very important. The next one is the difference. The difference, you compare and contrast the public perception and the perception of the experts. You compare and contrast. This is very, very important, because it influences how we are going to manage how you are going to carry out the communication, how you are going to carry out the communication. An example is usually there may be some differences. For example, during the COVID-19 pandemic, of course, experts know how it is transmitted, or the cause of the pandemic, but within the general public, some people believe that it was caused by 5G network. 5G network. So there is a difference. There is a difference between the passive public perception and the expert perception. Okay, so the next one is once you compare and contrast with what happens with the general public, what happens with what happens with what happens once you're able to compare the experts and the public perception, you can now decide on the communication strategy. What communication strategy are you going to use? What communication strategy are you going to use? And the type of communication strategy you are going to use can be divided into four. Can be divided into four. When the outrage of the public is low, while the hazard is high, you know that you are going to adopt what is called the precaution advocacy. You have to adopt what is called the precaution advocacy. So when the public outrage is low, it means that the public doesn't see the condition as harmful. The public doesn't see it as harmful as what the experts believe. The experts believe that the situation is harmful, while the public believes that it's not harmful. An example of this is flow stations, crude oil flow stations. Crude oil flow stations are known to be radioactive. They are known to be radioactive because of what they call the naturally occurring radioactive materials that are brought out with the crude oil from the deep inside the soil. Okay, so but you don't feel radiation. You don't feel radiation. You don't even see radiation. You don't feel it. But they have the capacity of causing cancer. They have the capacity of causing cancer. So the public may think that there is no risk in living close to a flow station. Meanwhile, the experts believe otherwise, probably because they have a special instrument that is capable, a special instrument that is capable of measuring that radioactivity. So in this case, in this communication strategy, what is called the precaution advocacy, the intention will be to scare the general public a bit, to increase their outrage so that they will be able to take action. Usually the general public will not take action except they feel threatened. So in this first stage, the communication strategy is to give the general public the information, the enough information that will make them to feel threatened. And it's only when they feel threatened that they will take preventive action. For example, by not residing in close to the flow station. Okay, so the second stage that is usually considered is what they call the outrage management. And this outrage management is deployed when the outrage is high, but that is public outrage about the hazard is high, but the level of hazard is low. So the experts believe that the hazard doesn't cause much significant health effects, whereas the general public is agitated, the general public is panicky. Okay, so in this case now, the communication strategy we are supposed to adopt is what they call the outrage management. An example is a black suit. The black suit. During the black suit crisis in Port Harcourt, a lot of things were said in the social media. People believe that it is dangerous. If the suit touches your skin, you will just come down with cancer or severe skin irritation almost the next minute. Okay, and people were advised to wear coverall, to cover their food, to do all sorts of things, to bathe even up to 5 times a day, or 5 times a day, because they were outraged. The general public were scared. Meanwhile, the experts believe that it is not, that the hazards are not as severe or as high as the social media is making the point. So in this case now, the communication strategy we are going to use, or that is supposed to be used, is what they call the outrage management. Outrage management. Outrage management is to reduce the level. The outrage management is to reduce the fear of the general public. Is to reduce the fear of the general public. Is to reduce the fear of the general public. This is usually very, very difficult. To reduce the fear of the general public is very, very difficult. You have to do it in a subtle way, because if you come all out and say that there is no risk, the general public, they may turn against you. So what some people have tried is what they call the masterly inactivity. In that case, now you do as if you are doing something, meanwhile you are doing nothing. Meanwhile you are doing nothing. In that case, now the patient, the government, the general public will think the government is doing something about it. Meanwhile, they are not doing anything. During the Port Harcourt blast suit, what the state government did was to set up a committee. Set up a committee, and that committee was constantly telling the public that they are working. They are working. Meanwhile, it took them more than close to 2 years to release their report. And by that time, the general public had moved on to other things, So that is how this second stage is managed, what they call the outrage management. The third stage is called the crisis management. And this is required when both the hazard and outrage are high. So both the general public and the expert believe that the condition is harmful. Both the general public and the experts believe that the condition is harmful. Okay, so in this case now, the communication will be to just maintain that level amongst the general public, so that they will continue to take preventive actions. An example in a situation like this is include crude oil spills. A crude oil spill is dangerous, and the general public usually often believe that it's dangerous because they would have seen how everything dies, things that are killed, the fish, plants, a lot of things that are killed by the oil spill, and even the smell. So yes, and of course the experts also believe. So what the communications strategy used, what is called the crisis communication, is to maintain that level of outrage amongst the general public, so that they will continue to take preventive action. And we said an example of this is during during an oil spill. And then the final one is the stakeholder relation. In this case now, both the hazard and the outrage are low. So what is low. So the communication, there is some communication between the public and the experts, and it's just geared towards continuous reassurance. An example is the Fanta colored water of Baesa of Yenagoa. So the general public believes that it's not that harmful. It's not that harmful, and the experts also recognizes that it's not harmful. The experts also recognize that it's not harmful. So in that case now, this stakeholder relation strategy is what is being used when both the hazard and outrage are low. When the hazard and outrage are low. So the other one is that, okay, so we haven't decided the strategy. What do we do? We design appropriate messages. And to design appropriate messages, and when we design appropriate messages, we have to also decide what communication medium to use. What communication medium we are going to use. Are we going to use the traditional media like TV, radio, newspapers, town criers, or are we going to use the new media, social media? Are we going to use any of them? Social media, are we going to do that? Text messages, are we going to use that to disseminate the messages? We have to decide. We have to decide. And how do we do the packaging? Who communicates the message? Do we youths prefer the use of celebrities? So if you want the youth to be excited, you have to use celebrity. If you have in traditional society, in traditional in traditional societies, the elderly, especially the elderly with white beard, definitely in Hausa communities, when somebody with white beard speaks, they believe that is the truth. And then in religious leaders are also very, very important. Very, very important because people believe in them. So it will also be nice for us to use them. Previously, experts like professors and health workers were believed, but right now, a lot of persons don't believe them that much. A lot of people don't believe them that much, but they can be explored. They can still be explored in that communication. And of course, you have to, when you do something, you have to measure the effectiveness. You have to measure the effectiveness to find out if you are achieving what you're supposed to achieve. Okay? So these are, we have gone through this risk communication. I don't know if there are questions or comments on what we have said. Questions, comments? Yes. Yeah, Barry.
Yeah, I already dropped the question in the comment box when you were talking about.
Yes,
the situation where the. Can you bring back the slide of that outreach something? Sorry, sir.
Sorry?
There was a slide you talked about the outreach.
Yes. This is it.
No, it's back. Yeah, this one. Yeah, this second stage.
Yes. Outreach management.
There was a terminology you used. I just wanted to know the name. What was the terminology?
You say?
There was a terminology you used.
That is different from outreach management.
You just mentioned it by passing, so I was thinking maybe I didn't get it well.
I can't remember. What I'm saying is this: in that outreach management, the public believes that the hazard is very, very harmful, whereas the expert believe that it's on the low side. I think that is basically, I can't even remember. I can't even remember that the term I used.
You're trying to say that when there is no hazard and you can't just force expert opinion on the public. There is something.
Yeah. Okay. I mentioned what they call masterly inactivity. Because if the public are convinced that something is harmful, and the experts probably coming from government saying that come openly, frontally, to say that that thing is not harmful. That's a tendency for them to think that the government is not saying the truth or is hiding something. Remember, if you cast your mind back to these unidentified flying objects, people still believe, especially in the US, they still believe that the government was trying to hide something. The government is trying to hide something from them. So to prevent that, what is recommended is what is called the masterly inactivity. In this case now, you do as if you are doing something. Meanwhile, you are not doing anything. You are doing almost like putting up a show. You are putting up a show for the general public. Okay, so what's yes? So that term is masterly inactivity. Okay.
Thank you, Prof.
Okay. Thank you. Do we have any other question? Okay, so yeah, I think there is another question. SN.
Okay, Prof. Good evening. Thank you for the presentation. So I just want to ask, during the Ebola outbreak, how would you stage that will I say communication issue? Because a lot of people were rushing to go and take bath with water and salt and all that. Can we say people were just blowing it out of proportion, or the level of hazard wasn't that high?
No.
I just want to know about it. Thank you.
It is the situation where we have a lot of information. And unfortunately, those information so in that case now, the public perception is different from that of the of the experts. So in that, what is being done in that case now is to find a way, a more convincing thing, a more convincing way of a more convincing approach, a more convincing approach, probably direct demonstration. You know, there was a time they were accusing this weed killer, glyphosate, this thing they used to kill wheat that is causing, is harmful and all those things. So what the CEO of that company Thomas had to even put his hands, dip his finger into the wound to convince himself that it was indeed Jesus. Okay. So apologies, so I lost my I don't know this guy. Okay, sorry. So, Madam Maria, you have a question to ask?
Okay, I have a question, sir.
Okay.
Now, yeah, I saw you mentioned risk communication, one of the strategies. And then we also saw, we talked about, what is it again? I've forgotten. There's risk communication, there's crisis communication. So I'm a little bit confused. Then what's the difference?
Okay, you know, they are all crisis communication is a strategy under risk communication. But in this case now, in the case of crisis communication, both the public and the experts are unanimous in their belief or their perception, in their belief that the situation is harmful. So, which means that it's a crisis. It's a crisis not only amongst the public, but also amongst the experts. So, which means that they had to do everything to control the situation, like oil spill, like oil spill. But usually in that kind of communication, you will state the hazards, the health hazards, but you must always give hope. You must always give hope. And because if you don't give hope, the general public will move into the state of hopelessness. If you don't give hope, the general public will move into a state of hopelessness. And in that case now, they will stop trying. They will stop trying. And when they stop trying, that is where the problem will even escalate. Okay? So in this crisis communication, you talk about the hazards. You talk about the hazard, but in talking about the hazard, you must say that is hope. You know, at times when we talk, for example, during the Ebola, we didn't get our communication right. Because a lot of people were saying that it's incurable, it's incurable, it's incurable. But they are still telling people to go to the health center. So if you say it is a disease is incurable, why are you telling people to go to the health center? So we didn't get that communication right. It should have been that it is a severe disease. A lot of people die, but people have a greater chance of surviving it if they go to hospital for treatment. That would have been a better way. But instead, they were saying, incurable, incurable. So people had to run from health facilities and they started going to places where they will accept that nothing is impossible. And that is where the faith healing comes in, because with faith healing, you believe that everything is possible. Everything is possible. So, okay, so that is a good example of crisis communication, in which, although you recognize the danger, but you must always give hope. Because if you don't give hope, the general public will move into a state of hopelessness. And a state of hopelessness is not good for the situation. They will just freeze. They will stop trying. They will say, they will even recourse to divine intervention, which may not necessarily be too helpful. Okay. Hello, Rosemary.
Good evening, Prof. Please,
Good
Prof,
evening.
I want more explanation on the carcinogens.
Yeah, carcinogens are things with the capacity to cause cancer. Things with the capacity to cause cancer. And we said that even if even if they are of the same group, in the same group, they may not have the same ability to cause cancer because they were classified based on laboratory and even human studies. Even so, if they found that drinking water caused cancer to so person. Hey, unfortunately, hey, Agatha, sorry, unfortunately, I lost my whole ship. I lost my whole ship, so I can't mute Agatha. Hello, okay. Iheanacho, is it possible for you to hand over the whole ship to me? Hey, Esther, hey, how am I going to do this now? Hello, Pinel. Is it? How am I going to? Okay.
I think they've muted it. Please, sir, can I see the screen? The slide having the different types.
Okay. So we are saying that in spite of the number, in spite of the classes, they classified the carcinogens based on the evidence, based on the evidence. Those in group A, in group 1 are those that they were able to find evidence in human studies. Those in group 2 are those they found evidence, had limited evidence in human beings, and then, of course, the good evidence in animals. And then possible, group 3, those with their mechanism of action makes it possible for them to cause cancer, like heavy metals that produce a lot of radicals, free radicals. And free radicals are like fire, and fire can burn the genetic materials. And once the genetic materials are destroyed, the cell can go haywire and become cancerous. Okay, so that is that.
Okay, sir.
Yeah.
Okay, sir.
Okay.
Hello, okay, Prof, so, please.
Yes.
The classification, I noticed the classification is different from the one in the bus. So I don't know.
In the what?
The one in the bus beside it.
Okay.
I don't know which one.
Yeah.
So that we don't...
Okay. Yeah. Okay. I think you said I was just trying to copy and paste. Okay. This one is a little bit different. And this group 5 is not there. Group 5 is not there. Group 5 is not there in the, yeah. So, but that one there's no evidence of carcinogenicity. No evidence of non-carcinogenicity. So it's not there.
Which one should we stick to, sir?
The one with the 5.
All right, sir.
Yeah. Okay. Thank you. So we can move on. If there is no other question, we have to move on to the social marketing. Social marketing is another form of health education. Social marketing is one of the tools that public health practitioners are supposed to have, because public health practitioners are designers of health programs. They are designers of health programs. They can design immunization program. They can design a public planning, anything, maternal and child health program, antenatal services. You can package them. But what social marketing does is how to advertise them, how to convince the general public to patronize the service or the product you have conceived. Okay, and it uses marketing techniques, commercial marketing techniques. But in commercial marketing, their interest is profit. But in social marketing, the interest is not the profit, it's not the money, but how to get people to patronize the service. It is not, in public health, it's not enough to just provide a service. You must find a way to drive the service. Remember, in the first course, we are talking about the conditional cash transfer. In that case now, in the end, during the NDG, the NDG, when they were building NDG projects, they built health centers and the rest, built schools. And they found out that in some communities in Nigeria, people were not going to those health centers and children were not being sent to school. So what they did was they said, okay, go to, they conceive this social marketing thing. Say, okay, go to school, ensure that you keep your child in school, patronize the health center, and at the end of every month, we'll give you 5K, 5,000. And they were doing it during the Jonathan era. So that is what social marketing does, not just for profit, but to drive demand, to encourage people to utilize products and services. So social marketing is formally defined as the application of commercial marketing technologies in the analysis, planning, execution, and evaluation of programs and products designed to influence the voluntary behavior of target audience in order to improve their personal welfare and that of the society. So that is a long or formal definition. But to summarize, or to simply put it, social marketing is just the use of commercial marketing techniques in the promotion and distribution of health services and products, not for profit, but to achieve social goals. Okay? And just as in the other forms of, okay, so the thing we have to also say is that what is being marketed is not just products. It's not just products, or it can be service. It can even be intangible thing. It can be intangible thing, but you must precisely define what you want to market. So that even if it is intangible thing, you have to precisely define it that people can even see that product in their mind's eye. People can see the product, or sorry, what you are selling or what you are marketing in their mind's eye. Remember this physical activity that is increasingly being prescribed, almost like a drug to everyone. Physical activity has been defined as any activity that moderates to severe physical activity, that any activity that is enough to make you breathe faster and to make your heart beat faster. Yeah. So it doesn't mean that you have to go and wear tracksuit and be doing 1-2 like they do in the gym. No. Anything you do, you can do walking, you can trek. Yes. Anything that can make your body, can make your heart beat faster and make you go breathless a little bit is what is prescribed. And not only that, they say you should do it for 30 minutes and for at least 5 days in a week, or a total of 150 minutes in a week. Okay, so which means that they are precisely define it. So they can market it. They can market it to you. To market it to you is to ensure that you are able to do that no matter how busy you are, no matter your place, no matter whether you have a tracksuit or whether you have a sneaker, no matter what, you should be able to do. You should be able to do that. Okay, and then yes, okay, and then okay. So, but for you to market a product, you must know the person, the audience, the person you want to market the product. You must know everything about the person, what the person needs, what turns off the person, wants attract the person, what the person prefers much more than that. You remove the inconveniences the person feels, and then you package a program that appeals to the patient or to the person. And that is how marketing is done. That is how marketing is done. So So to do that, you have to do a study. This study is what they call the formative research. The formative research. Formative research. And the person, when you are doing the communication, when you are talking, this marketing, when you are selling the product, it is not just the person with the problem. You will sell the product to what is called the primary audience. Primary audience is the person with the problem. You can also target what they call the key influencing audience. Key influencing audience are people that make it happen. Make it happen. Make it happen. For example, children. Children, their key influencing audience are their parents, are their mother, especially their mothers. Especially their mother, because the mothers are those that do things on behalf of children. And even depending, if you want a household to feed very well, it is better you target the mothers, the mothers who decide what the members of the household are fed, who decide. Yes, so they are called the key influencing audience. And not only that, there is also a third audience that you can even target. They are called the primary audience. Primary audience are those with influence. Primary audience are those with influence. Or they are also called significant others. These are people that can influence the primary audience. And in Nigeria, one of the most potent primary audience are the clergy. They are very, very powerful. They can tell a lot of Nigerians to sit, and they will sit. Tell them to stand, they will stand. Let me not use what Fela said about zombie. No, yes, but they have that power. They have that power. And that's why when you are doing a lot of things, when you are doing health education, health communication, you have to make sure you befriend those religious leaders, because they are very, very important. They are very, very important. Okay? They are very, very important. Okay? The other one is if you package the program, you have to even know when best to meet them, where best to meet them. Is it at work? There are certain things that are certain messages that are better at certain times. If you want if you want things that are if you want to make something compulsory, do it in a school or at work. Do it in a school at work, because once you get the workplace to adopt it, or in the school for it to be adopted, is taken. Okay, then in public health, in marketing, we have in social marketing, we have the 4 Ps, and with the information we have gotten of the audience, we now apply. We now use it to package what we are marketing, and these things will work on the 4 Ps. And these 4 Ps, they stand for product, price, promotion, and place. Product, price, promotion, and place. And you have to package the product, what you are marketing in such a way, in such a way that they are compelling. They are compelling. We talked about the product, what you are actually marketing. We said it can be physical, it can be tangible, it can be non-tangible. But even if it is non-tangible, you must precisely define it so that there's no ambiguity what you want. There's no ambiguity what you want. In that way, it is better. Don't just tell person to exercise. No, it is not good enough. Tell them to exercise. Give them the dosage of that exercise. In fact, the dosage of the physical activity. The dosage of the physical activity. And also, yes, and precisely define it. It's not for you to stretch. We are not talking about stretching, and you call it physical activity. You must do something that will make your heart breathe faster or make you to breathe faster. Okay, so you have to precisely define it. And then you begin to make the product appealing. How do you make the product appealing? How do you make the product appealing? The relative advantage. How is it? You have to make it better than the others. You have to make the product better than the others. Okay? You have to make the product better than the others. And then compatibility. Does the product fit well with the intended audience? You want to make sure that even for busy mothers or people that are busy, what you are planning, what you are packaging is doable for them or works for them. If somebody like now, they say the physical activity, you don't need, they say 30 minutes a day, 30 minutes a day for at least 5 days. It doesn't mean that you go all, or you do a stretch. You can take them in bites. You can take them in bits. You can take them in bits. 2 minutes here, 5 minutes there, until they add up. And the life is getting better. Life is getting better and easier for even physical activity. Because if you have a smart watch, and these smart watches are even getting cheaper. They are getting cheaper. With less than a 10K, you can get one, and you can actually count the number of steps you have taken a day, and that will be good. So it can be compatible. No matter how busy you are, you can still find time. You can still find enough time. Okay, you have to make it the advantage. We are talking about relative advantage. You have to make it better than what. I'm interested in, say, medical checkups. Instead of doing it, medical checkups that is being done, that you will go all over the hospital doing one test here and the other test there and the other test there, and you spend literally 1 month, more than 1 month, carrying out the medical checkup. Why not you do a what they call a one-stop shop? You go to one place and you are able to do all the tests. You are able to do all the tests. You can even pay a lump sum, a single sum that covers all the other, or instead of paying little amount, and you have to be you have to be going from one point of the hospital to the other. So you have to make that package the product in such a way that it is better than the others. It's better than the others. Complicity. So you have to make the product easy to use. Easy to use. If you are talking about drugs, why not do it a single dose? You take the drug and that finishes. That finishes it. You take the drug and no problem again. So it's not anything complicated. Anything complicated. In fact, even products now are being sold what they call the DIY. Do it yourself. Do it yourself. So you can, on even those apps, you can do a lot of things. And the other one is a triability. You must try. You must give the people the opportunity to try it. Try it before buying. Try it before buying. Even when people that are buying cars, even including new cars, they are given the opportunity to test run the car. They are using the opportunity to test run the car. So even if for toilets, things like toilets, you can build it in a public place. Build it in a public place where people can use. When people can use the toilets in a public place, and if they like it, they'll be convinced to build it to public, to build that they build to build their own toilets at home. Then the other one is the observability. You have to show proof. You have to emphasize the results. If you want to convince people to stop smoking, the emphasis shouldn't be that to prevent untimely death. No, it is difficult. Or even to say to prevent cancer. No, it may take more than 20 years for a smoker to develop lung cancer. So it won't work. So instead, you tell the person about the smell. Tell the person about the smell. Tell the person about the portion to others, to non-smokers. Tell the person about the heart that will stop racing, that will stop beating very fast, and they will accept it. Yeah, they will accept it instead of a long-term benefits. And then brand. You have to brand it to make it distinguishing, make it to distinguish it, make it to distinguish it. When you create a brand, you can make sure that it is associated with quality, make it to be associated with quality, or an image that image that is interesting to people. Yeah, an image and interesting to people. And a lot of times, you can increase branding, leveraging on the religious belief of people, of the person, can be helpful because of the stronghold religion has on people. So branding can be of very good choice. Okay, then that is we have done that of product, where you have to package it in a compelling way. You have to package it in a compelling way. The second P is the price. The price is not just money, but what you exchange. What you exchange the bad behavior with. What you exchange the bad behavior with. It is the opportunity cost. Is the opportunity costs. So if you want to, is the opportunity cost. It's not just the money, but the other things, the other price you have to pay. If you have to lose weight, to become slimmer, it means that in Nigeria you will lose that appeal of that look of affluence. In Nigeria, when people are on the fat side, they are seen as rich. So if you lose weight, you will lose that that affluence. At times is the convenience. Is the convenience when you do something. Yeah, we are talking about this one-stop medical checkup. One-stop medical checkup gives us that convenience. For those of us, if you have patronized the tertiary hospital, you know that for you to access service, you are all over. You move from all over the place, all over the hospital. But a one-stop shop, if you go to one place and you're attended to, that solves it. That solves the problem. And then even the time, the money, the time and the money, they are all things that one will have to look at when we are packaging a product. When we are packaging a product. Okay, when we are packaging a product. Another thing that have also been shown is the bundle. When they combine something, when they combine two products. In fact, even if, those of us that have shopped online, this online shop, once in a while they say they make a bundle. They say combine two products. They combine two products. In fact, one of the best marketing gimmick, one of best of which was used by Cowbell. I don't know. I'm sure that some of us are aware of. I've seen know about Cowbell. That Cowbell. In fact, it used to be called Abiola milk. I think they started marketing it around when Abiola was having his problems. It was said to be cheap. But what made Cowbell cheap is the fact that it has a lot of sugar, and sugar is usually less expensive than milk. Okay, so so they were able to sell their supposed milk that is at a cheaper price, because most of it, at least probably about 20-30% of it, is actually made up of sugar. So that is what bundling does, and we can also try it when we are using social marketing. Mix expensive thing with a non-expensive thing. Yes, and then reduce the price. Okay. Then the place. Oh, I need to. I know that Opera is not speaking. Opera Chizoba, can you just mute yourself, please, if you can? Hello, Opera.
Sorry, sir. Sorry, sir.
Yes, thank you. Okay, so the third one is the place. Where do we place it? Where do we make it? It is, as much as possible, we should make the product available at the time that is convenient, as a convenient time and a convenient place. When the Society for Family Health started marketing their family planning products, including condoms, they make them available at almost like the point of need. So you could buy condom at the Malon shop, the grocery shop, the neighborhood shop, not just in hospitals, but in kiosks and all those places. So you have to put the products at places that will be very convenient. For children, it should be incorporated. When you put it in a school health, it makes it better. For adults, occupational health and so forth. You have to put it at a place that is convenient. And even in communities, nothing stops immunization services to be provided during the evening hours. Yeah, so that the mothers can go to work, and then come back. When they come back, they can now bring their children to the immunization clinic. So all those things will have to be considered. So it's not a must that, say, health services must be provided during the morning hours, because if you do that, it means that people will have to leave work to access those health services. If you think that changing the timing, like probably providing those services during the evening hours, will improve the service, then so be it. You should do it that way. So the placing is also very, very important when we are marketing a product. Okay. We have talked about the norm one-stop shop. You go to a place and you are able to do everything. You go to a place and you are able to do everything. Then the other one, the fourth one, is the promotion. How do we promote it? Social. You have to do it in a convincing way. Using different media. I think social media is becoming very, very important, and even very cheap. It's almost like a course of video. You don't need to pay. You don't need to pay a lot of money. Create a video, put it on social media, and it may even go viral. At little cost. Unlike in the traditional media where you have to pay advert rates. So promotion can be, and you have to work it out. What will convince people to act? Earlier we were talking about Nigerians. Nigerian men will not want anything to go wrong with their potency. And Nigerian women will move mountain to ensure that they are able to conceive. So that's why those people that advertise their products in those traditional medicine practitioners, that's how they advertise their products, saying something like this, that if you don't treat If you don't treat your staff, the thing will turn to HIV and things like that. So you have to make it convincing. Make it convincing. And to make it convincing, we talked about even who will send the message. Who are you going to use? Celebrities for the youths, religious people for their congregations, professionals if you want to move stuff, technical matters, and so forth. You have to consider all this. You have to consider all this. Okay, and then the other one, what they call the additional P's, apart from the 4 P's we have mentioned, there are additional ones, and they include the policy and partnership. Policy has to do with government policy. At times, government policies can give us a boost. For example, government, we talked about the import duty waivers for certain goods, for public health goods. Anything, if you are providing public health goods, government usually don't tax. I think government don't tax. The tax on health services are minimal, because they provide health services. And then even the traditional media that usually charge money for adverts, usually at times they have public service announcements, and these public service announcements are usually also provided free of charge. And then if you are an NGO, if you operate as an NGO, you are not taxed. So that tax relief, you can use it to subsidize their products. You can use it to subsidize their products. And then partnership. Partnership is very, very important. If you are able to partner with religious bodies, that will go a long way in ensuring, that will go a long way in gaining acceptability. That will go a long way in, say, gaining acceptability, especially in a country such as ours. Okay, I don't know if there are questions or comments. Questions, comments. Questions, comments. Okay. I don't think, okay, there is no question, and except, okay, hello, Valentine. Hello, Valentine.
Good evening.
Yeah, good evening. Hello.
Prof, I just a very small comment.
Yes.
Hello, Prof, can you hear me?
Yeah, I can. Valentine, go on now.
Yeah. I'm talking concerning the area of bundling. That give an example, you get people use bundling too for the promotion product, or get one particular product and then there's a product that is attached to that product that you may get for.
Hey, Valentine, I'm actually struggling. Okay, he has actually left. His network wasn't great. Hello, Oga user. You are a user, so I don't know if you will recognize your name. User, please, your hand is up. You can say something. Go on. You have unmuted, so you can go on. Hello? Hello, user. Okay. Okay, I think there is no response. If there is none, we will just quickly talk about this advocacy, which is where we are going to end. Which will be, where we are going to end. Advocacy, we have to find a way. At times, they used to say that human needs are unlimited, but the resources to fulfill them are scarce. So if we are practicing public health practitioners, usually the government allocation, you will be funded by the government, or you're an NGO and you have a grant. At times, what the needs are more than the money that is available. So you have to look for extra funding. You have to look for extra funding, and to look for extra funding, you have to use a different form of communication. You have to use a different form of communication, and that communication has been includes what they call the advocacy. Includes the advocacy. The advocacy is how to make somebody to do something. How to make somebody to do something, and that something can be to offer his service, to bring money, to bring other things, to bring money, to bring equipment. So how do you do that? How do you get members of the community to do something? How do you get members of the community to do something? How to do something? How do you get them to do? Is to present the problem of the community in ways that appeal to the holder of the resources. Since you are you want to raise some resources to tackle a problem, you have to present the problem in a way that will appeal to the person, in a way that appeal to the person. So each and every one of us have areas, soft areas, or what some people have called bubu button. Yes, bubu button. We all have that, and that is what advocacy and lobbying, market, that's what it aims to achieve. That is that button it intends to press. For members of the community, like influential persons, you can meet them in their places, and hail them, what they call the community entry process. So even if you are visiting somebody, you have to come presenting gifts. The usual thing is for you to go and you'll be entertained. But when you are going to raise, you want the cooperation of members of the community, influential members of the community, you have to go bearing gifts. You have to go bearing gifts. And even in the Niger Delta region, they say even if you present the drink, you have to wage it. And to wage it, you have to add money. You have to add money. Just a token. A token. And it's just to show your respect. It's just to show that you respect the person you are visiting. And with that show of respect, if you are in a Yoruba, you can even dobale, as the Yorubas do. Once you show enough respect, that individual will be able to do something. That individual will be able to do something. So for a politician, you have to talk about votes, how what you are doing will translate to votes, how what you are doing will translate to votes. For religious people, you can go spiritual. You can go scriptural, quote the Bible, quote the Quran in making a presentation, and they will be moved. And then for friends, and even for influential persons, you can say that they may not use it, but their relations can. Their relations can. And if they have, but they can also use it in an emergency. If they are visiting, if they are at home, in their hometown, they can develop a medical emergency and the facility should be able to help them in that. So you have to state it in a way that will be relevant, that will make them move. If you tell politicians they like votes, they like what they do to translate to vote, so you should be able to say that, tell them that. Another way of also doing, and when you collect the donation, please broadcast it, say it, say it, say it, broadcast it, give an award, give an award. They like that. They like that, except when they were instructed otherwise. But Nigerians, they like their donations, no matter how small, no matter how small, to be acknowledged. And social media has also made it easier for us to do. Yeah, social media has also made it easier for us to do. And then even you can talk to antagonists. Talk to antagonists. It's not just those that agree with you. You have to also talk to those that oppose the program. Those that oppose the program, and then tell them that you are not a direct competitor. You are not direct competitor, but they can actually be partners. Actually be partners. In fact, antenatal services in a place need not to be openly confrontational to TBAs, but you can work together. You can work together and just encourage the TBAs to do the right thing and to also refer when necessary. Refer when necessary. When necessary. Okay, so for companies, they have what they call the corporate social responsibility. The companies, they have corporate social responsibility, and this corporate social responsibility is tax deductible. Tax deductible. In fact, it's a way of making sure that your tax actually benefits you and your host community. As your host community. So when companies, when they do something for the host community, it's not completely because they like the host community, but because it is a way of deciding where to spend where their money will be spent. You know, a lot of us pay tax in Nigeria, but we can't actually pinpoint what our taxes are being used for. So corporate social responsibility is a way of doing that, ensuring that. It's a way of ensuring that. Then for philanthropic organizations, you have to think about what they like. What they like. For big donors like Bill Gates, you have to know where their interests are, what they are interested in sponsoring. For NGOs, charity is also very good. Charity is also very good, taking care of the needy and so forth, taking care of the needy and so forth. For foreign governments, remember we talked about a global public health good. Foreign government, they make donations because they mostly fund the global public health goods because even if they are using it in your country, they also benefit indirectly from the decrease in spread of those diseases. Okay, and for religious bodies, can work with them work with them, especially in tackling their peculiar health problems. For religious organizations like like Jehovah Witness that don't take blood transfusion, you can work with them. You can work with them to ensure to prevent blood loss amongst the members, and also I think collaborate with them in looking for alternative to blood transfusion in treatments. In fact, the Jehovah Witness are funding, they are providing a lot of research grants, funding the research into how to carry out bloodless surgeries. So we can work with them. We can work with them based on that. Okay, so we have actually rushed through. I don't know if there are still questions, comments. Questions, comments. Okay, there are none. Let me apologize for the inability of some of my colleagues to give those lectures. Between tomorrow and next, we'll make sure that they give those lectures. And let me also thank you for your response. Some of you are paying for the conference. So thank you for the vote of confidence. We always do our best. We know times are hard. So if you don't have the money, don't worry. Don't worry. You have more than 6 months to pay. So don't worry. Don't worry about it. You will still have time to pay. So I don't know if there are other questions or comments or anything that we need to address before we call it a day. Lamidi, Aminat. Hello, madam.
Good evening, sir.
Good evening.
Yes, sir. So it is regarding the conference, sir. They sent a message on the Barter platform. They were to send the receipt to after payment. So I don't know. I sent my receipt to that number, and my message has not been acknowledged since Saturday. And I messaged the
don't worry,
the problem.
Don't worry, it will be acknowledged after this lecture.
All right, sir. Thank you very much, sir.
Thank you. Hello, Peter.
Yes, sir. Good evening, Prof.
Good evening.
Prof, you talk about Jehovah Witness undergoing a lot of research on bloodless surgery, carrying out surgery without blood transfusion. Please, I wish to know, has it been possible? Have they succeeded? Especially when it comes to
I think they are, because they have been carrying out some trainings. And then, but the other thing too is the preventive aspects. The causes of blood transfusion in Nigeria, the major cause, especially among children, is malaria. So they are teaching, they are ensuring, they are at the forefront of ensuring prophylactic treatment. And then amongst pregnant women, they are also in their Bible studies, they are promoting the intake of hematinics, to build up the blood of the pregnant woman. So the emphasis is on prevention, so that they will not get to that level of requiring or being tempted. Okay. Hello, Ikenna.
Hello, Prof.
Yes. Okay, Peter.
Yes, Prof. Anyway, I think when it comes to that issue, they are just deceiving the populace. Because having worked in the clinic, I know many of them, when it's at the bench of no option, they always do it. But when they are teaching their followers, they won't tell them the risk involved.
Yeah, actually there are, yeah, that's why, you know, in our Lord's Prayer, they said, lead us not into temptation. Yes, at times it's the last. In fact, I know of one church that wasn't taking drug, that wasn't taking any modern drug, until the son of the prophetess died. In fact, he was even supposed to take over the ministry, the church.
Apostolic faith, sir.
Yes. He was to take over, and the guy died. And when he died, the church just changed the doctrine. They say, okay, it's led for the person. If you feel that you have enough faith, don't take drug. But if you feel your faith is lacking, you can go ahead and take the drug. So they have made that revision. But that revision was caused by the death of the prophetess' first son. Okay. Hello, Ikenna.
Okay. Good evening, Prof.
Yeah. Good evening.
Yes, sir. I'm just trying to maybe I know you noticed initially when the class started we were quite few in number.
Yeah.
That was due to the disconnect we had today. Dr. Jule was about said she was going to come by 7, and
okay.
I also got an earlier update from the coursework from the MSc that we'll be having a combined class. But just before 4, I also heard that you were taking them. So while you were in the class, she called me that she was about coming. So I think maybe after the class, you would need to talk to her so that both of you can align on how we would have this
No.
Tuesday and Wednesday's class.
No. I actually I wasn't. They called me around 4, and then I said, okay, instead of not having anything, let me just come in. That wasn't communicated, and I think you are also fortunate that you got her. Did you get her with the glow line?
I think that number I can't even say, but it was through WhatsApp.
Okay, it was a WhatsApp, but because I noticed that she was sending messages to our platform, lecturers platform. But that's if you call that number, it will be switched off. Okay,
that's true, sir.
But it's all right. Anyway, we just hope that she will. I don't know if
she asked me to call her after the class too, so maybe I will give you a feedback after the call.
Please, yes. Yeah. I could have, because at the time I was yawning seriously. I was tired. In fact, I just managed to. Yes, I could have yielded the class to her if I was informed earlier. But it was okay. And you people cannot
thank you so much
today, so she can have.
That will be tomorrow, sir.
She can have. She can have all the day. She can have. I think I have to call her to make sure that she can.
All right, sir. Thank you so much, sir. Yep.
Thank you. Well done. Yeah. So thank you very much, and have the best of the rest of the evening. Thank you.
Thank you, Prof. Good night.
Good night,
Thank you, Prof. Thank you, Prof.
Good night, Prof.
Thank you, Prof. Thank you, Prof. Good night, Prof.
Good night, Prof. Thank you, Prof.
Good night.
Thank you, Prof. I'm grateful.
Okay, good night. Thank you.
Hello, Penel Ihenacho, can you quickly end the meeting so that it will stop recording, please? The hosts, can you quickly end the meeting if you can hear me?
Okay, I will call her now. Maybe she's not close to her.
Please tell her to end the meeting so that the recording won't be too long, okay? Thank you.
Okay. No. It's not picking, no. I'm still trying.
Okay, so I'll try to reach speed link to end the meeting for us so that it won't record for long. Thank you.
Hello, Sierra. She's not picking.
It's okay. I'm also trying to get Sweetling, but he's not responding at all. So maybe we'll have it long, but I'll keep trying.
Okay.
Thank you.
All right, you're welcome.
Yeah.